Okay, so we're at 6:05. So people, you're still welcome to come into the chat, but I think it would be great to get started. So welcome again. This is our talk, Period Poverty in Sub-Saharan Africa, with our fantastic speaker this evening, Modupe Adeagbo. So welcome, Modupe, and everyone, thank you. And I'll hand it over to you.
Thanks, Angela. Thanks, everyone, for joining. As Angela said, thanks for taking time out of your evenings to really just come together and spend time talking about this really important topic that is really close to my heart and really passionate about, and it's really not spoken much about. So I'm really excited to talk about it this evening. I'm first going to introduce myself a little bit, as some people have been doing. As Angela mentioned, my name is Modupe. I'm 24 and I'm Nigerian. I was born and raised in the UK, and then in 2015 I moved to New York for 4 years, and I did my BA in Global Public Health at NYU, New York University, which was a really great experience, and it really solidified my interest in public health and global health. I think I was always interested in the overarching healthcare system between the UK and Africa, and health policy as well. So being able to study that degree really gave me a really good understanding and just whole understanding of the whole public health spectrum, which was great. Playing up here because I really love to travel, books because I'm a bookworm, I love to read, and then this little thing in the corner because I'm a huge foodie as well. So I hope that gives like a good overview of me and why I'm really passionate and interested in public health, but specifically women's health and this topic today. So I know there are a lot of people on the call who may not know what period poverty is, or they've never heard about it, but I will start from like the complete basics and then kind of do a run up until where the conversation around period poverty is today. But I wanted to start with how I heard about it, which wasn't that long ago. It was in 2019, and I was volunteering at an organization called WaterAid, which a lot of people might have heard of. It's a really huge global organization that basically provides water sanitization and hygiene services all around the world. So I was volunteering at WaterAid, and I was sat on my computer, and this article came around within the internal staff, and it was titled "How Women Around the World Manage Their Menstrual Periods." And it really stood out to me because I saw all the photos on the screen now, and I didn't see one like sanitary towel or tampon that I was used to seeing. And so I was really interested in understanding how women kind of use these products and how they don't have access to kind of regular products that we're used to. So I remember kind of opening the article, and I came up with these kind of 3 different stories. There was several stories, but these 3 really stood out to me. So there was a young girl from Pakistan. She was 18, and she used just like a random piece of cloth every month because she couldn't afford sanitary pads. And similar to her, there was another young girl from Malawi who also used a piece of cloth. And the story that really stood out to me was this older woman, and she was basically talking about how she was teaching her children and her daughters how to manage their periods. And she actually used cow patties, which is basically hardened cow feces, and it would be wrapped in newspaper to be like a solid hardened material close to a pad. And then that's what they would use to manage their periods. And I remember just being so shocked by that, and so like, yeah, just so surprised that this is what was happening, but also surprised that I had never actually thought about this conversation. I never, even as a woman myself, thought about how other women who don't have access to these products, who can't afford these products, manage their period on a monthly basis. And that kind of kicked off my interest. And I'm someone, if I get interested in a topic, I start researching it, I start reading about it, I start like writing about it. So that's kind of where my interest started in understanding period poverty and wanting to know more about it and how to help. So I'm going to play a video. It's just a 3-minute clip from an organization called the COVA Project. And they basically work across Africa, distributing menstrual cups, which are very sufficient for women who are living in Sub-Saharan Africa. And it basically just covers, it speaks for itself, the video, but it covers a lot about how these women react to these products, how they distribute them. So I'm just going to play that. Please let me know if you can't hear it.
This feels like a very special time. Girls around the world are coming together, having each other's backs, and trying to make life a little easier for each other. We're aware of the things that hold us back, and we're looking for solutions. For the COVA project, that solution is safe sanitary care. Which is why in April we travelled to Liberia and Malawi to distribute menstrual cups. We understood the benefit of the menstrual cup, but we weren't entirely sure how it would be received. So travelling to these countries with this package was something of a risk. But the moment we got started, we had nothing to fear.
I can see girls, I can see women, young, they're fighting to come and get it because it was very good for them. Yes! Okay, I just said with the interesting house as a marco. These things, they're easy and they're comfortable the way we have seen it, and we know that this can be a great deal for us. Thank you.
I'm very much excited for these things. It's going to help me to walk anywhere, to do anything that I work at jumping, pregnant, or anything. I'm welcome to be about one. It was just perfect and I liked it. Yeah. And I hope when I'm going to do my periods, I'm going to use it, and this will be very perfect.
Putting it in for 12 hours, and I can use it over and over and over for 10 years.
Donate to the COVA project today and help us provide access, education, and dignity.
So as you can see from
This feels
the COVA project, I really love because they create really sustainable ways for these products to be distributed, especially within communities within Sub-Saharan Africa, places that are remote, maybe really hard to reach. These products, you can literally go and distribute them. And like they were saying in the video, they can last up to 10 years. It's not something that has to be, that has to keep being redistributed, which I think is really amazing. It reaches a lot of people. And yeah, I just think that overall, just a really great organization. So I really like this quote. I think it's very apparent for the times that we're in now. It says, periods don't stop for pandemics, and the work to improve access to essential tampons, pads, and reusables has never been more important. I think during a global pandemic, obviously this is the biggest global health issue that I've seen in my lifetime, a lot of people have seen in their lifetimes. And a lot of people don't have the capacity to focus on anything else. For example, I work in an organization that's working on eradicating malaria. So other things are happening and other things do need to be addressed. And I think this is something significant that needs to be brought to the table and needs to be brought to conversations like this and higher up in places so period poverty can be eradicated. So I'm going back to the basics here, as I said I would, and explain exactly what period poverty is. So period poverty occurs when a girl or woman can't afford proper menstrual hygiene products. That's just the simple definition of what it is. Today, over 1.2 billion women across the world do not have sufficient access to these menstrual hygiene products. So obviously that's a very significant number, and a large proportion of those women are in low and middle income countries, especially in Sub-Saharan Africa. Women and young girls who menstruate are excluded from basic daily activities. So in the video, I'm not sure if you picked on it, but there was a girl who was saying that she was really excited to get these cups because she could do some running and jumping, she could play netball. And these are just basic activities, not even things like school and work that women literally have to stop every single month when they don't have access to these products. Gender inequality, cultural taboos, poverty, and lack of basic services often cause menstrual health and hygiene needs to go unmet. The tampon tax or period tax on menstrual products is also significant within middle and low income countries. I think this is something that's also significantly important, and I will touch upon as well, because this is what actually makes the period products and menstrual products so expensive and so inaccessible to people who are living in low and middle income countries. There was a statistic I saw that said the cost of sanitary towels for a year is the same cost as schooling for a year or rent for a year in countries such as Malawi and Ghana. So for women to actually purchase these products, they're giving up, a roof over their head, or they're giving up going to school. So it's not really a luxury. It's not something that they can really just benefit from and buy every single month. It's something they really have to think about and say, am I rather gonna live somewhere and have a roof over my head, or go to school and have an education, or actually have the option to buy a tampon this month or a sanitary towel and manage my period? So that's also very significant. So when discussing global health issues, it's very important to look at the population group. So I've learned that a lot when looking at different issues. You can't just single it out. You have to really hone in on the group it affects. And obviously when discussing periods, they affect women, and specifically women in Africa. And what this accounts for is not just something that is interlinked. There's a lot of stuff that go together. So for example, periods, not having access to sanitary towels means missed school days, means missed work days. There was a statistic that said, I think 20% of the schooling year is missed by girls who can't go to school when they're on their periods. So they actually miss a huge chunk of education. They miss a huge chunk of assignments. A lot of them, they don't graduate, they don't get to complete their schooling, and that kind of sends them back into the cycle of poverty. That's also linked to some traditions of child marriage that are still sadly practiced in a lot of African countries. If girls are actually not going to school because of their periods and not having the opportunity to graduate and go on to higher education, they're kind of seen as not burdens, but in their families, they can't afford them, and the only way for them to take care of them in their minds is to marry them off at such a young age. So there is this cycle that really links a lot of issues together. They're not really separated. So it's very important to look at the bigger picture also when discussing these issues, and not just see them as isolated issues. There's also a shame and lack of confidence around a lot of these issues within communities. It's not something that's talked about openly. It's a taboo. It's seen as something shameful. And so that leads on to the next point, which is mental well-being. This really affects mental health in young girls, not having the opportunity to talk in school about this, with family, with friends. It's very much something that happens naturally, but it's made to seem as something shameful. So that also all links together and creates this mental unrest and difficulty just managing yourself and knowing how you can kind of speak about these issues that are happening to your body, but everyone kind of wants to seem to ignore that. So that's also very significant in affecting women in Africa. So here are some facts and figures. There's a lot of information out there, but these are just some main points that I think are really significant to this conversation. So 1 in 10 girls in Africa misses school due to their period. So as I mentioned, that's about 20% of the school year. And the majority of girls in Sub-Saharan Africa do not have a complete and accurate understanding of menstruation as a normal biological process. So this really stood out to me because it comes from a lack of education and ignorance, but also just not having a girl understand exactly what's happening to her, not having them know. It leads to kind of those opportunities for you to feel shame, for you to feel embarrassed, for you to feel all these different emotions that should not be felt about something that's very much natural. But that starts with education, because this is very much linked to ignorance. So that's a very important part of this whole process, is education and teaching people, teaching girls, teaching older women to teach their younger women, and really just understanding the process of that this is a natural thing and it's not something to be ashamed of. In many African countries, approximately 50% of school-age girls do not have access to sanitary products. Obviously, that's a very significant number. It's just like half. And approximately 90% of women in Sub-Saharan Africa do not have access to women's healthcare services. So this number is very significantly high. And also it's very discouraging, because this links in with just wider healthcare issues. Period poverty is really under women's health, and overall women's health is very underfunded, especially in middle and low income countries. Women don't have access to a lot of services, whether that's seeing an OBGYN to have you checked for gynecological services, or going to have a prenatal scan. These kind of different elements are just really underfunded, and that's what creates a lot of issues. Even in the UK, for example, we have simple things where you'll get a letter when it's time to get your cervical scan, or if you need to get something checked out, you get all this information. But in these countries, there's no opportunity for that. There's no outlet for that. So women are very much dying, actually, from a lot of preventable diseases, preventable illnesses, and period poverty really just sits right under that issue of women's health. So having access to women's healthcare services is also an overarching theme in this whole discussion, and the center point, actually, of a lot of issues of women's health in Africa. There are a lot of articles within the most recent years that have been discussing period poverty, especially in human rights organizations, Human Rights Watch, Amnesty International. They've been doing a lot of articles and conversations around this issue as well. And there's been an uprising of new charities and social enterprises that are really focusing on addressing period poverty, specifically to keep girls in school. That's a lot of the work they're doing surrounding this topic. Is kind of like, we want to keep girls in school, so let's sort out the biggest thing that's keeping them out of school. And this is obviously all amazing work, it's all incredible, but we need to keep the conversation going. We need to get it to higher levels. And I think it's very important to have conversations like this to educate people, so they can spread the information and really just get it on some high level platforms in high level places and industries. So this can really be something that is eradicated, and everyone has access to all the products that they need. So as I mentioned before, it's very important when discussing global health issues to look at the population group. And in this sense, it's women, and as I've mentioned before, specifically women in Africa. And I think understanding the issue within this context is very important. I remember I did a module in university about anthropological public health, and it's very interesting because you really have to focus on a community and the population group that you're studying to understand a public health issue. And in this sense, it's women in Africa, and that's a very specific population group. And so when middle and low income countries face hardships, especially in low income countries, it is women and girls that suffer the most. So this is, for an example, a pandemic, famine, war, those kind of situations. It's women and girls that bear the brunt of those things that happen, and they actually get the most out of them. They suffer the most out of them. And so, for example, in a pandemic, you're having a family that's earning less money, parents have lost a job maybe. The last thing on their mind probably is going to be getting, sanitary pads or things accessible to their children or their daughters that they have. And so it's really important to take that into perspective. In many African countries, women are the cornerstone of their families and foundations of the communities. So this is very significant, I think, to a lot of African countries where women, they do a lot of unpaid labor, they do a lot of things around the house, they do side hustles, they make, you know, shea butter, and they're doing tailoring, and there's a lot of things that women do within these communities, and there's a lot of communities that literally depend on women. And if they're having this chunk of time every single month where they can't do anything, it's really kind of setting the communities back, it's setting their families back. And so it's really important to keep them healthy, to keep empowering them so they can keep kind of propelling their families, propelling their communities to push further. And healthy women do build healthy societies. I do really believe that. And so I think it's imperative to focus on building healthy futures for this group that is so significant, that's so important. So this quote really leads right into solutions. I've talked a lot about problems and period poverty in general, and how it's really just affecting such a huge number of women and girls across the world, especially in low-income countries, especially in Africa. But this quote really, it gives me hope. And so it says, educate a woman, you educate a nation. And I think this really leads on nicely to the solutions, because as I mentioned before, education is the key for so many things. There's really so much ignorance about this topic. And so using education as a tool is just really, really important. So I believe there are three core areas when discussing period poverty: education, distribution, and advocacy in terms of solutions. So if we start with education, this relates to the previous quote on the slide, as I mentioned. It's all about eradicating ignorance and building societies where periods can be spoken about in a normal and natural way. It not only takes away the shame, but it also allows for further conversations to be had. And I think a core factor of this is menstrual health and educational programs. I remember when I was in school, we had something called like PSHE in the UK, and it's basically something where you talk about like social issues, talk about like women's health and sexual health and all these things. And I think that's really crucial to having in schools. I think it's crucial in teaching girls about their bodies. I think it's also crucial in teaching boys because they should be aware of it as well. So I think it's something that should be really supplemented within the educational system, especially in Africa, because from what I hear, it's just unheard of. No one really discusses these issues, especially in school. And if there's something, whether it's every month, that is a part of the educational system where they can have that opportunity to learn from this and understand about their periods, it could be really helpful. The second point is distribution. And this basically just means getting out as many products as possible, whether that's from the cups we saw in the video before, or in this photo, like reusable pads. These are very effective in these communities because it's very, it would be very difficult for these girls to keep going and buying, you know, products that they can't afford, or having to keep distributing them. So these are really effective methods. But distribution just means getting them far and wide, remote areas, villages, small communities, big communities, and reaching as many girls as possible who live in like underserved communities and really need them. So this could be done really effectively through community healthcare workers, which I'll discuss in a later slide, but they are really core to so many communities in Africa. They are basically like community nurses, and they know everyone, and they are a core population group to distribute these. These can be also done through school. School is a great way to distribute menstrual health products. It's a great place to educate as well, as I mentioned, but also distribute. As you're reaching a lot of girls, they can take it home, that they can give to their sisters, their friends. So you're reaching even more people. And then FemBox, which is my organization, which I will talk about later as well. A really great way to distribute and reach wider networks. And the last point on solutions, I would say, is advocacy, which is the last but definitely not the least important at all. I think this is really, really crucial in lobbying and activism, and really creating noise and creating awareness. This starts with definitely changing laws on taxing these products, and increasing healthcare services in public health programs, increasing them within the healthcare system, and really just making it top of the agenda in various countries, in various governmental bodies, and really just promoting that discussion. So there has been a lot of progress I definitely don't want to ignore this. I think this is really significant. As I mentioned, there is a lot of work that's being done. So last year, Scotland became the first country in the entire world to make period products free. And so it's now their legal duty to ensure that items such as tampons and period pads are available to anyone who needs them. I remember when I saw this and I thought it was really incredible. I didn't expect, I thought it was a bit random, Scotland, but it was so wonderful. And I remember the UK was then having conversations about it. And it definitely propelled this conversation about it, because it says, you know, if they can do it, why can't we? And that was very, very encouraging. And then it also moved to Africa, because South Africa removed the tax, and then Rwanda removed the tax on sanitary products. And so it is definitely more of a conversation. People are definitely catching on to these issues and why it really just doesn't make any sense to have these ridiculously expensive products that are something that is natural, something that someone can't help. Why are we, you know, taxing these? Why are we making them so inaccessible? There's been a lot of distribution as well that's occurred. This has mainly been through charity work though. So distributing to health clinics, schools, universities, local communities, anywhere basically where these organizations can reach a large number of girls who need these products, which has also been great. It's definitely needed for the government to get on board and to really propel these to be rolled out in large numbers. But charities are definitely doing what they can to really advocate and really get to young women everywhere, which is amazing. And also implementing women's healthcare services and national public health programs and universal health coverage is very, very significant. Conversations around this were happening. I think once Scotland actually made these period products free, there was definitely a lot of that happening, a lot of that conversation happening in the news, and specifically implementing women's healthcare services and universal healthcare coverage in a lot of African countries, because healthcare is just so expensive in countries where a lot of the population is living in extreme poverty. So it really doesn't add up, really doesn't make any sense. So I know a lot of these conversations are happening, a lot of progress has been made, but there is still a long way to go. And I think that should be definitely acknowledged. So I wanted to talk about FemBox and a bit about my solution and where my passion took me. So since discovering all I know about period poverty, I became incredibly passionate about the topic and creating solutions. And I started this organization called FemBox, which is to support women and girls' physical and mental health and reach rural and urban communities. And the idea basically came to me from studying some countries. Like I said, when I get really interested in a topic, I do a lot of research and I do a lot of just like binging on videos and articles and all that stuff. And I really aim to study other African countries when I'm looking to solve issues within Africa. I think it's really great to look at what the US is doing and what the UK is doing in new technology, but a lot of things that those countries are doing do not apply to countries within the continent here. So it's very important to look at other countries in Africa who are doing amazing things. And I studied closely Rwanda and Ethiopia, who had significantly high women's healthcare issues and maternal health issues, and they significantly reduced them. And this was all done through community healthcare workers, which I mentioned before, but I would definitely go into a bit more because it's very, very important and key to eradicating period poverty, in my opinion. And community healthcare workers were basically just girls, they were mostly girls in low-income communities and villages, and they would have doctors and nurses come to train these girls who were really intelligent and really passionate about helping their communities. And they would basically teach them how to take blood pressure and how to take blood and how to do rapid diagnostic malaria testing and simple things like that. They would tell them to distribute nets to prevent pregnant women from getting malaria and tell them to distribute sanitary products. And these people, they became just like the go-to people in the community. They were trained, they were smart, they were happy to help. A lot of the people trusted them in the community. They'd known them for a long time, so they felt more comfortable going to them. And what happened in Rwanda and Ethiopia was the rates of women who were basically dying from childbirth, they would basically go to these community healthcare workers, they would get checked out, and they would realize maybe they had high blood pressure, and they would go to hospital and they'd be diagnosed with preeclampsia, which is a preventable, a treatable actually illness in pregnant women, but if it goes undetected, it can be fatal. And so because they were actually being sent to the hospital earlier than they would usually go, they were saving lives. And those countries basically noticed that these workers were really crucial. And I think rolling out community healthcare workers in all of Africa is really significant in eradicating this issue. So FemBox basically includes menstrual products for 2 cycles, sexual health information, feminine wipes, hand sanitizer, and extra pair of underwear, basically just a little package to manage your periods. And they will be rolled out through mobile clinics within really remote areas, places that are really hard to reach, and distributed. And the aim is not just to get these products out, but to start a conversation, to start a community. When you go out into those communities and distributing them, you're speaking to these girls, you're hearing their stories, and then they're coming back time and time again, and you're building a network. And I think that's really important. I think that's really significant within this conversation, to actually not only give people resources, but also start a wider conversation about this topic, which is very important. And I also think the reason behind community healthcare workers that work so well was just having them within these communities. They were so able to speak to people and so able to nurture those relationships. And that's exactly what FemBox aims to do, and to really support girls, nurture the relationship, and have it as an ongoing thing. In the future, it would be great to have a physical clinic where we can actually see girls and see women who come in and do similar things such as scans and checks and all these things to prevent further like healthcare issues that are so prevalent in these countries. So it's definitely an overarching women's health topic, but it starts from sorting out period poverty, and it starts from sorting out this issue that is within so many communities. So I did plan a fundraiser to happen last year, and then the pandemic happened, but I'm definitely planning another one. I'm hopefully going to have 2, so I'll have one in the UK and then have one in Nigeria as well, to really launch the organization well and explain what we aim to do, and hopefully get a lot of people excited and on board and ready to help. So that will definitely be on our website and Instagram, which I will share in a bit. And I know a lot of people probably want to know how to help and how to show support, especially if this is something you haven't heard about or anything. But I really like this quote that says, "Women and girls have human rights and they have periods. One should not defeat the other." I think that's very important, and just reminds me that this is something that is so important and should be fought for. So I'd say the first point is educate yourself. I say this with a lot of things, and it's just my first point of when I see something that I'm interested in and I want to learn more about. I do a lot of reading, I do a lot of researching. I think that's the first point. I mean, you can literally Google period poverty in Google, YouTube, anywhere. You'll find articles, videos, and you can go down a rabbit hole of just finding out a lot more about the topic. And yeah, just so you have information that you can just kind of dispose at your conversations, and whenever you want to talk about it or whenever you want to know more about it, it's very easy. Donate sanitary products. I think this is really easy to do. There are some really great organizations that are working really hard to distribute these products to girls. And so it's as easy as if you're going to the store and you're buying your own package of tampons or pads, just buy an extra one and then get it across to these organizations. It's usually super simple, but that's just a really easy, an easy way to help as well. Speak to family, friends, co-workers about period poverty. I put especially men because they're usually neglected from this conversation, and they shouldn't be. Especially in today's society, we've had a lot of progress, obviously, with women in more positions of power, but men do hold a significant amount of those positions. And I think it's very important that we understand they are the people who are making changes, and they are making laws, they are changing taxes on things. And so I think it's really important to include them in the conversation. And then I would say volunteer at charities that are also working to eradicate period poverty. I think that's also just a really simple way to help and just kind of be part of those conversations and also learn in person as well. So thank you everyone for listening. I hope that was really helpful, and I hope I covered a wide range of what period poverty is as best as I could. Here is my name and then my email for FemBox if you want to find out more about period poverty or what FemBox does, or if you have any questions or you just want to say hi. My inbox is open, please feel free. And I think we're going to open up to questions.
Yes, thank you so much, Modupe. And that's been a really fantastic talk. And I've learned so much, definitely from an African perspective, and then also even countries like Scotland, like globally, can help tackle this problem as well. Yes, everyone, if you have questions, feel free to unmute yourself. We can have a bit of a chat and a bit of interactive discussion. I'll give everyone a minute or two. We already have one fantastic question from Lara on the chat, and she says about local initiatives, and are there initiatives to locally produce these products so they can be more affordable for most of the countries around the world? Is there a way to make them more affordable?
Yeah, that's a great question. I think it starts from not taxing these products. So that's a really great way to make them affordable, to make them accessible. But in terms of reaching, especially women and girls in Sub-Saharan Africa, I think the best method is using actually reusable products. So in the video, they were using cups. In other elements, they've used reusable sanitary towels, and those are actually effective measures to sustain them. It's not, I love organizations that come into Africa, for example, and they actually give these people the tools to manage themselves. It's not something that they have to constantly rely on charities or organizations to keep coming back and keep giving them things, to give them the tools and give them something that they can use for like 10 years or 5 years, and something for a long period of time that they can really manage themselves is empowering. And so I think that's also just a great method, specifically when looking at girls in Sub-Saharan Africa, how to manage their periods. I think reusable methods are the best and the most cost effective as well.
Definitely, and I really also appreciate your talk about saying how there's something everyone can do as well, contact local organizations. And does anyone else have any other questions? Feel free to mute yourself.
Hi, Dupe. This is my name is Yvonne. I actually wanted to talk about, ask about educating, or how do they go out to the schools or to the marketplaces? Do you have ambassadors? Are there ambassadors that actually are doing this work? Or how is this meant to sort of reach? I know there are a few people around the world that are doing it, but in terms of taking it back to the grassroots, what is the opportunity, or where are the opportunities for people to become ambassadors of actually promoting period poverty? Because I think when you can get it at that level, you have the ability to start reaching more and more people. And so I just feel, I'm asking, what are we doing in Sub-Saharan Africa? What are the initiatives? Governments, are we working with local governments? Are we working with big governments? What are the things that we can put in place that can actually help from the grassroots up to bring it to, so it becomes something that is on the agenda going forward? Because I think once you can educate that group at the bottom, you actually begin to see a change. So I'm just wanting to find out, what is there anything in place with regards to sort of promoting it at grassroots, or getting ambassadors out there that can actually promote it?
Yeah, that's a really great point. Thank you. I think the best way to start is actually what I mentioned when I was talking about community healthcare workers, and using people who are currently on ground and who are currently passionate and interested already about the topic, who have a vision and want to work towards eradicating it. So it's basically just using them and promoting their work, promoting them in these industries. I think in terms of governmental agencies, unfortunately, when speaking in Africa, I think it's best to leave them, and they will come on board. If it's an initiative that is growing and really working in this, they're seeing that things are positive and thriving, they can get on board and start interjecting. But I think it's best to start from local charities, small organizations, and have them work together, whether they're going to local schools, whether they're going into communities, whether they're having training people who are they then in the communities and speaking on behalf of people. I think that's more authentic, it's more real. I think that's what people are more after now. They don't really want someone from the outside coming in and telling them, you know, this is what we're doing. They want someone who's actually experienced it, maybe someone who's actually, you know, come out the other end, and someone who can really know what they're going through. So different.
I think that's why I was asking, where is it at with that's why I was talking about ambassadors, not necessarily governments, but, you know, working right at the grassroots, the people who can actually take it to the schools. How effective is that? What are the things that we can do to help to promote, or to even just, you know, get that message out there? So I totally, it's not about the governments, because I know governments are way far removed from everything that is happening at the moment. And it's not even about, even with the NGOs as well, it has to be very small ones that can target these, not the big ones, because of course that's all saturated. So I'm talking more about how can we, you know, one voice or one person, is each one, you know, affects another person. So it's just using that word of mouth, going out there and just talking about it as best as we can. But I'm just thinking more of, with the health workers on ground, can we, or how do we sort of help them sort of get that word out there a bit more? I know, yes, the boxes and those things are good, but like you said something about, you know, using reusable towels, you know, how do we actually promote that? Because of course we're looking at what they will see from the West, and they see all this stuff that is disposable. And it's a two-pronged there, because you're talking about sustainability as well of things, or of the environment as well. So are there ways that we can actually do it very sustainable without thinking about going down that Western route? And, you know, are we looking at bringing in the right people to talk to them and say, it's not always about having things from the West. It really is about how to make it sustainable and cost efficient, really, for that. That's what I was thinking about, not governments. I'm not talking about.
Yeah, no, 100%. And there are so many organizations, as I mentioned, already doing this work that are actually African-based organizations. There's an organization, for example, I'll try and find their name, but she literally makes reusable pads, and she distributes them within her communities. And literally all it takes is some research. I put some names up as well, of some really great organizations that are African-based organizations already doing the work. So I do like to take a lot of work away from myself sometimes, and sometimes there are already people who are already doing things that you can actually support instead of trying to do something yourself. I started up FemBox because I couldn't find anyone doing specifically what I wanted to do. But in terms of ambassadors and people who are, you know, just leading the way, there are so many of them, and they are in local communities, they're in local organizations. There are a lot of them, so it just takes like a little search and you can find so many, and support them in different ways, whether it's through fundraising, if you don't have funds, through amplifying their voices, sharing them in your network, you know, just giving to them when you can. Like, there's so many other ways to support. So yeah, that's what I would say.
Thank you, Modupe. We just had two more similar sort of suggestions about different organisations and other ways to get more information, from Emma and Olinke. Is there any particular ones that come to mind if we want to start Googling and having a look more about this topic after the talk?
Yeah, so I would say Care International do a lot of work. There's an organisation called Flow, which they actually just launched in Nigeria.
Okay.
she just launched in Nigeria, Flow, FLO, and she's a really great organization. She's working on basically just promoting educational resources, so really just educating people on period poverty. So there are a lot. I will put some names in the chat now to share.
Thank you, Modupe. There's so much that we could definitely keep researching this, and it's a topic we definitely need to know more about. Just to let you know, also we've had some fantastic thank yous on the chat, so do have a check into them because you've been really fantastic. It's been great to learn about this topic. And also, if you could share your main screen with your email, a couple of people would love to get more in touch with you. So if you could do that, you might get a few emails from some people on this talk, because do get in touch. Modupe has been fantastic in sharing her organisation and what she knows. And it's definitely something, the more we know, the more we can help each other, the more we can tackle period poverty and other issues. I think I'll give everyone a minute for a last question or two. We're just at the last little bit, but I do want to say thank you again to Modupe. We've really learned a lot, and this could be such a more longer talk, so definitely do get in touch. Keep an eye on our social media. We're going to be sharing this video if you want to watch it again or share it with others. And in 2 weeks' time, we have another digital talk, so keep an eye on our social media and we'll be posting more about that one. I think I've
got a question.
Oh, there we go, one more.
Oh, okay. I was going to ask a question. Hi, thanks a lot for that talk. It was great. I just want to know, like, when you talked about starting your organization, I just had the thought of, like, how did you do it, and what was that process like? Because I know you said you got in touch with, or you tried to use the community health workers, but I don't know. I wonder if you could, like, share a bit how that process was of actually starting the organization.
Sure. So it was quite impulsive. I just I'm very very much a solutions-driven person. So when I saw the issue and I saw that there were just huge gaps, what could be done, and quite simple solutions, I thought that something as simple as kind of a package box that could be delivered would be effective. But then I couldn't think of ways to distribute it. I thought it could go to schools and universities maybe, but I thought to reach the most remote areas, the best way would be through kind of like mobile clinics and distributing through someone like community healthcare workers who, like I said, I like to make life easier for myself, and they're already in place. They already work and do amazing things, and they're already super passionate about women's health and these kind of issues. So using them and bringing them on board, having them as part of the process was quite an early idea for me. But then it just developed from there. It started from a lot of research. I think I just did a lot of research. I researched people who had started organizations to eradicate period poverty as well, to support women's health issues. I contacted some people, so they gave me some advice and information, which was great. People are like usually very much willing to help. So I would definitely like advise doing that if anyone also wanted to find out more, just reach out to people. And then I just started from there. I started from my network. So I started just sharing with people I know, and I have a lot of Nigerian friends. And so they were very much passionate about the issue as much as I was. And so it just started from them supporting and them, donating and them encouraging me, and then me kind of working with people I met. I did a lot of networking. I think I learned this while I was in New York, that networking is like a huge thing. Wherever you go, you never know who you can meet. And so I remember I was working one time. I came to shoot a campaign here in Lagos, Nigeria, and I met this guy who was a doctor, and he was really passionate about like women's health, and he had specialized in like women's health, and then he was like helping me so much with like distributing, and he wanted to help with like packaging and introducing me to community healthcare workers. So I think that's a huge part as well. If you like can't email people and they don't respond, then literally just go out there and start like speaking to people. I actively went out there and met people who were interested as well, so they were definitely more willing to help, so that was great too. I hope that answers your question. Okay.
Definitely, thank you, Modupe. And just, we've asked so much from you, but you said today you launched a new initiative. Would you like to tell us one or two things about that?
Sure, yes. So I'm working at an organization based on eradicating malaria. And we basically launched our campaign today. It's called Zero Malaria, Draw the Line Against Malaria. We filmed here in Lagos a year ago. It was supposed to launch last summer, but it was postponed because of COVID. It's a really incredible campaign. It's youth focused. We've got some really amazing African talent in it. Eliud Kipchoge, who's a Kenyan marathon runner, Sia Khaleesi, who's the South African rugby captain, some really great Nigerian artists in the campaign. It's super powerful, really incredible. I actually should have put it in my presentation, now I'm thinking, but you can go on Zero Malaria if you go on Instagram, and you can watch the video and support the cause. It's a really incredible campaign.
Super. Thank you so much, Modupe. You've spoken for so long. Thank you so much. We've learned so much. I could listen to you for hours. I'm definitely going to look at some of those organizations and do more research in my own time. Do check out the chat, because lots of other people are really grateful to you as well. And it's a topic we do need to hear more about. There should be a lot more out there. To everyone here, thank you so much. We'll have to wrap up, but you do have Modupe's email address if you want to get in touch. And please check out the Resolve social media, and we'll be in touch with you for further talks. And have a lovely evening. Thank you so much, everyone.